Welcome to the podcast. Today we will be speaking about the NHS 70th anniversary Windrush and Commonwealth Nurses Initiative. 2020 is Florence Nightingale's bicentennial year and has been designated by the WHO, that's the World Health Organization, as the first ever global year of the nurse and midwife. We have two interviews, speaking with three people in total. First interview was with Antonia and Jack. Antonia Valentim, she is responsible for managing a COVID-19 center for Portuguese and Spanish migrants living in the UK. She's also managing director at Africa and the Diaspora United. Together with her is Dr. Jack Beula. He is founder and CEO of the Nubian Jack Community Trust, which is a charity. He is responsible, or the trust is responsible for the initiative. That is the NHS 70th anniversary Windrush and Commonwealth Nurses Initiative. And we will start with Michelle Johnson, who is chief nurse at Whittington Hospital and director of allied health professionals at Whittington Health NHS Trust. And I'm starting with Michelle, even though I interviewed her last, because it paints a very clear picture. Nurses always have been on the front line, but at the moment they're working 24/7. These are very trying times, and I thought that came out very clearly out of the interview. I'm very happy that she took a couple of minutes off her time to speak with me and really supporting, obviously, the initiative. Here we go. First, Michelle, and after that, Antonia and Jack.
Oh, hi, it's Michelle Johnson here.
Michelle, hi. Thank you so much for taking the time to speak with me.
You're very welcome.
You're chief nurse at Whittington Hospital,
I am. Yeah, so I'm chief nurse, and the trust is called Whittington Health.
Whittington Health, right? Okay, yeah.
Yeah, which is an integrated care organisation, which includes a district general hospital, as well as community health services. So that's in people's homes, and also we have mental health services.
And I understand that you're well known for educating and training nurses. Is that what Jack told me? Is that correct, or?
Yeah, well, so, we work with our local universities to train nurses, pre-registration nurses, nurses who are doing more work-based apprenticeship type training, as well as post-registration.
Jack told me you know him quite well. I understand that the statue itself will be placed in front of the hospital.
That's right. Which is very we're a trust in North Central London. So it's an inner London borough that the hospital is in, and then we provide community and mental health services across two very diverse and very deprived boroughs, which is Haringey and Islington. The population we serve is highly diverse and predominantly is from a Black and Asian minority ethnic population. And our workforce reflects that. So we have a workforce of about 4,500 staff, and 46% of them come from a Black and Asian minority ethnic background.
Right.
And we have a long history of recruiting staff and welcoming staff from across certainly all nationalities, but going back in time through to the Windrush of the 1950s, a significant number of nurses and midwives were placed at what was then known as Whittington Hospital, or its predecessor names. Trusts in the UK tend to change their names quite regularly. So we have, a number of staff who, family members came over as part of Windrush from the Commonwealth back in the 1950s and 60s, and have connections with Whittington Hospital, or they might be a district nurse, or a community midwife, but working in our local geography.
Preparing, so that is why the statue will be placed at the hospital.
I think it will be so symbolic for our staff, and powerful message that we recognise the contribution that nurses and midwives have made from across the Commonwealth for many, many years.
For how long? Since the 50s, you mentioned, 1950s.
So the first, the boats came from, the Windrush, HMS Windrush came from the Caribbean to London.
Yeah.
And a number of those staff, people came to North London.
Yeah.
And have been part of our community ever since.
Fantastic. Obviously, this year also, and I spoke about that yesterday as well. It's the 2020 is really the year, according to the World Health Organization, of the nurse and the midwife, and it's really an opportunity to say thank you to the professions and to really promote nursing and midwifery as a career.
Yeah, it's a really significant year for us. So every year there is an International Day of the Nurse and International Day of the Midwife.
Okay.
And that the 12th of May is the Nurses' Day, and the 5th of May is Midwives, and it's acknowledged across the world every year. Okay. Those 2 days. Which is why it's supported by WHO. Mm-hmm. This year is so significant because it's the 200th anniversary of Florence Nightingale's birth.
Florence Nightingale,
so
right.
So, and of course, Florence Nightingale is renowned for her contribution to healthcare and nursing for many, many years, back to the Crimea War. So this year feels even more significant.
Yeah.
I suppose, I can't ignore, or not mention coronavirus and COVID-19. We've had to, our celebrations for this year's, International Day of the Nurse has been so different to what we expected and planned.
Yeah.
And of course, we were going to, to commemorate the day through the launch of this statue or the unveiling of the statue, and of course we haven't been able to do that.
It's just postponed, obviously, but a lot of people appreciate the profession even more at this point. Hey?
Yeah, I mean it's been incredibly hard the last 3 months.
Yeah,
probably, I've been a nurse for 30 plus years, and this last 3 months leading the organisation as the chief nurse has been probably the most challenging thing I've ever done in my career.
Yeah.
And that's on an emotional level, on a practical level of just having to work 24/7 or be responsible for all the care and all the staff for, just the last 3 months. But, also just unprecedented the things we've had to do and work in a different way.
Obviously, there was a bit of news yesterday from Boris Johnson. First of all, he mentions that the more bereaved families of NHS, they can stay in the UK. And second thing was that he scraps the NHS fee for foreign health workers. Obviously, after being personally helped by someone from New Zealand and from Portugal, from what I understand. So,
I just know from Whittington Health's perspective. Is we value and support every member of staff, whatever their, nationality or background or, where they, have come from. And that's a really important message for our organisation, is just how we value everyone, But certainly, the focus on the NHS as a whole has been phenomenal over the last 3 months, and the support for the NHS is, it's been lovely. It's been great for staff morale at a time when people are dealing with things that, have been so distressing and, just life-changing in a way.
Absolutely.
People's work life wasn't just changed. Their whole life was changed, wasn't it, with lockdown and, and the way, the population had to respond. Well, that applied to, all the NHS workers as well.
Yeah. Yeah, no, the work you're doing is really amazing, I must say. I believe Jack told me yesterday that you won an award, the Windrush Award. Was that this year or last year? And why was that?
It was 2 years ago. So for the 75th anniversary of the NHS, which was 2 years ago, they had NHS celebrations, and part of that was an award program for different, Nurse of the Year type thing. And one of our nurses won a Lifetime Achievement Award. She's one of our midwives, actually, for her commitment to the NHS for the last 40 years. And she was a Windrush midwife.
Right.
So she came as a child from the Commonwealth, settled here, and then joined the NHS as a midwife and still working with us today, which is just amazing.
Amazing indeed.
Yeah, absolutely. So she got a Lifetime Achievement Award.
Brilliant. I want to thank you very much for your time today and just taking that and calling me. That's absolutely fantastic. Thank you so much. Speaking today with Antonia Valentim, who is responsible for managing a COVID-19 center for Portuguese and Spanish migrants living in the UK. Please correct me if I'm totally wrong, and welcome to the show, Antonia.
Hello, good afternoon. That's correct. I've been working on this wonderful project where I understand that, there is a crisis, and we've been providing both communities with basic boxes of food.
Brilliant. And Dr. Jack Beula from the Nubian Jack Community Trust, responsible for commemorative activities. And also, please correct me if I'm totally wrong there. Welcome, Jack. How are you?
It's a pleasure, Peter. I'm very well indeed. How are you?
I'm very well. Thank you. Thank you for asking indeed. And I understand that you're very well known for independent plaque and sculpture schemes in the UK. And you're one of the few, actually, that is endorsed by English Heritage.
Indeed, that's absolutely correct. Yes, we put commemorative plaques and statues around the country. We're beginning to foray into international commemorations. Once the lockdown's eased, We'll be doing some plaques abroad, which I'll tell you about a later time. But yes, we're delighted to be probably the largest diverse plaque scheme in the UK, in Europe, in fact.
Ah, okay. And then you are a non-for-profit organization, just like English Heritage?
In fact, we're a charity. Yeah, we're a registered charity. Yeah. And like English Heritage, yes, we are dependent on, patronages from independent sponsors, etc.
Right. And I'm reaching out to you, obviously, because of the project that you're working on currently, which is the appreciation celebration of nurses and midwives who came from all over the Commonwealth to help the, at that point, fledgling NHS, from what I understand. Yeah.
Indeed. In 1948, of course, when the NHS was formed, we also had the year of the arrival of the Windrush generation. And a lot of them entered the NHS health service in its infancy. And it's been said, often repeated, without their support and contribution and dedication, the NHS would have died in its infancy. So we're very grateful to them, and we will be honouring them with a wonderful 7-foot granite statue at the Whittington Hospital in October.
Okay, brilliant. And obviously this is the year, I should point that out, and actually I didn't know that until a couple of days ago. So 2020 is the year of the nurse and the midwife. This has been designated by the World Health Organization the first ever global year for the nurse and the midwife. So,
absolutely. So this is the exact year, the ideal year, to be honouring them with a statue. Wouldn't it be absolutely wonderful? And also, to be fair, with the phenomenon, the global bug, the super bug, COVID-19 that's going around, there are many, many people, which Antonia will tell you a little bit about later, who have, dedicated, frankly, their lives and paid the ultimate sacrifice. Sadly, most of them have been from a minority background. So this statue will also commemorate them, Peter.
Yeah,
we'll also be celebrating their service.
I'll come to the numbers a little bit later, but I was actually shocked when I read that. But obviously this year is opportunity really to say thank you to the professions, showcasing their talents, their expertise, and to promote nursing and midwifery as careers. And obviously in these times, I think, no matter, I really think you should really think about those professions that are really doing more than is expected of them. They go beyond what is expected of them. If I look at bus drivers, a couple of weeks ago, 11 bus drivers in the UK passed away from the coronavirus. And obviously nurses are right there on the front line. And I think it's for something like 14% really globally.
BME staff?
Yeah, but it's like 33% really under a certain population that pass away. So that's quite significant. Now, I've got a question for Antonia. Obviously, what does it mean to you? 2020, year of the nurse and the midwife. What does that mean to you?
It means a very important event. After speaking, I was thinking how to approach this subject, but after speaking with Jack, I understood that he's doing an amazing project because we need to honor them. They've been our heroes. they've been putting themselves at risk to make sure we are all healthy and safe. But really and truly, this is all about looking after each other and giving a step further, even though if we're not professionals, to still help within the community. And this is where I come in, because as you know, people that work on the frontline NHS jobs, they usually live in crowded multi-generational homes, and where social distancing is very hard to practice. So we know that they most likely, about 40% or 50%, if I'm not wrong, of the deaths are more to come to do with these people who are from the African backgrounds and Asian backgrounds, and also the minority backgrounds. So they're dying every single day. They're dying like heroes, really, because they're putting themselves in front. It's just a shame the government are not taking the right measurements to protect them, because this group of people, like the BME, which is the Black and minority ethnic community, most of them suffer from underlying conditions that they are unknown of, because they sometimes prioritize their profession in front of the patient's health, and they don't even know they've got these illnesses. So the COVID-19 is just showing us that even though they're there helping other people, they may be not aware of what they're suffering from. And I believe that the government should put in place some procedures to make them either step down or work in different areas of the hospitals in order for them to keep providing the care for the patients. Because they're dying every single day. The number of deaths is growing on this particular group of the BME.
Absolutely. I actually saw an article this morning. It said that the staff employed by the NHS, BAME, account for approximately 21%. 20% is amongst nursing and support staff, 44% amongst the medical staff. And the deaths that occur amongst these groups account for 63%, 64%, and 95%.
It's quite a lot.
That's between 2 and 3 times as many as in the other groups that are really working. There's actually also a site on the BBC, bbc.co.uk, remembering NHS and healthcare workers who have died. They are really on the front line. By the way, I detect, I'm Dutch. I'm also not from this country, but I detect an accent there, Antonia. Where are you from?
Oh, I'm original from Angola, but I grew up in Portugal. So I've got kind of a mixture of cultures on me, because my maternal grandmother was Portuguese, and my father was a known woodcrafter. So you was traveling around the world working with all these important people, leaders, world leaders. He met them face to face. And then I became ambitious, seeing my dad doing that type of thing, and I started traveling myself. I end up in UK. I've got this accent, but my culture, even though I was born in Angola, I'm embracing my Angolan culture right now, because I'm working with different communities.
I thought it was Portuguese indeed, but Angola, they speak Portuguese there as well, obviously. And
we was colonized by Portuguese over 45 years now, and we now got our independence for over 45 years, but the accent is still there. The language is Portuguese, the main language.
Right, okay. I'm just coming to this because Prime Minister Boris Johnson has been in the hospital from the virus as well. He emerged from the hospital, and the first thing that he did, as a matter of fact, was not only thank the NHS, but he pointed out 2 nurses that particularly helped him. One was from New Zealand, and the other one was from Portugal, Louis from Portugal.
Louis from Portugal.
2 immigrants who served the NHS. Obviously, they were thanked by Boris Johnson. And there was an article in the newspaper today saying that the families from overseas NHS support staff and care workers who have died with the coronavirus, they can stay in the UK permanently. So I think they're appreciating it a little bit more after what happened to Boris. What do you think?
Yes, definitely. I think that Boris Johnson would have a different approach to the Brexit, or the situation with the Brexit, because he was actually treated and well cared by immigrants. But the only problem that I can see is that even though these immigrants are coming to the country to work in a very low wages, in the lowest income you can imagine. They still have to pay lots of fees. It's like they have to pay £400 a year to use the NHS services, on taxis and on any other things they need to pay because they immigrants, of course. But what really makes me sad is Boris Johnson mentioning that he needs to increase that tax in order to bring income to the country, which I don't think is fair because they're already in a very low income, and if anything happens to them, their families obviously will be deported with no legal status to stay. So it's just not fair. I don't think it's fair at all.
Absolutely. That has changed this morning, though. So the article was on BBC News this morning. As a matter of fact, just 57 minutes ago. So, okay, then I have a question for Jack. Obviously, 2020, year of the nurse, midwife. At the same time, we're looking at your project, which is obviously appreciation and celebration of nurses and midwives. That seems like a very topical moment to do so.
It's very laudable as well. And it's great listening to you and Antonia talk, because it's like the more things change, the more they stay the same. What the NHS is currently made up of, the makeup of it ethnically, frankly, is no different to when it was first patronised by the Windrush Commonwealth staff who came here. The employing of these overseas nurses and midwives and doctors and laundry staff and porters and all these wonderful people who made up the NHS, they would later become the bunt of the Windrush scandal. So without making too fine a point of it, after this cloud has blown over, I wouldn't be surprised if those who were zealous for Brexit and so forth again start targeting the minority communities, some of which we've now discovered have made the ultimate sacrifice during this time of the crisis. So it's like a cycle, and we feel it's time to punctuate these dedications, these contributions, with a memorial statue. And it's going to be the most beautiful, wonderful piece of architecture. It actually shows a nurse being or feeding a baby being suckled by a nurse. And of course, the baby is the NHS and the nurse is the said target group of Windrush nurses and midwives we'll be honouring.
Brilliant. And why Whittington Hospital?
Well, great, because when you speak to the Whittington staff, I met the chief executive, Siobhan Harrington, wonderful lady. Head of nurses is Michelle Johnson, who hopefully I think you'll be able to get an interview with. Whittington was the place where most of these nurses worked at. So historically, they have had the highest number of overseas nurses and midwives working at the Whittington Hospital. So it's the perfect place in North London to put up this national statue. It must be said, it was going to go up on the 22nd of June this year.
Obviously has been postponed, like everything else, right?
Exactly. And by the way, that day is Windrush Day. Yes.
That was Windrush.
It's Windrush Day.
It's Windrush Day, Antonia. Yes. So we've moved it to October, though, which is celebrated as Black History Month and a great chance to commemorate African and Caribbean culture. So we'll be installing it then.
Brilliant. And this is a collaboration between your trust, the Nubian Jack Community Trust, Whittington Hospital and the NHS.
Yes.
That's correct,
and the
right?
NHS. Absolutely fantastic. And there's so many nurses that will be memorialised. Like I said, not just the current heroes, the COVID workers, but people in the past like Daphne Steele, who in 1964 became the very first matron in this country. People like Jackie Hartley Bent, who actually delivered our two future years to this country. The two of the first three children by William and Kate were delivered by a black woman from Trinidad. Yes.
I did not know that. I've
in
learned
safe
hands.
Lovely.
Yes. And there's so much people that we will be memorialising, Antonia, on the day, as you know, that it'll be great. And it also is accompanying a book, Peter, which we won't go into right now, but there's an amazing book accompanying the installation of the statue.
Right. What's it called?
Lovely. What's the name?
It's wonderful. It's called Nurse in a Nation.
Nursing a Nation.
And it includes an introduction. Yes, it includes an introduction by Patricia Scotland, who's the current head of the Commonwealth. But it has 51 independent contributions, Peter.
Right.
So it's a wonderful document that will accompany this national monument, which I believe will be only the third in this country, throughout the entire country, that depicts a black woman.
Right. And you
So-
mentioned
Wow.
1948 as the year.
Yes.
Is that correct? And why were they invited, the Windrush and Commonwealth nurses? Why was that done?
Well, okay, so just to explain, the 22nd of June, 1948 was when a book from the Caribbean,
Yeah.
called the Empire Windrush, it was a warship actually, brought over 500 people from the Caribbean who were invited here to build up post-war Britain. So a lot of them were RAF, ex-World War II veterans, and a few number of them were women. You've got to understand there were a number of ships coming from the Caribbean within that time. 2 weeks later, after the Windrush, the NHS was founded on the 5th of July.
You said there was a ship that was arriving to build up post-war Britain, correct? Or...
Yes, that's absolutely correct. So, Peter, there were ships before the Windrush and after the Windrush. In fact, the Windrush generation has been described as from 1948 to 1972. And of course, during that period, during that 24-year period, a number of, 14-year period, a number of 48, 58, 68, yeah, 24. I want to make sure I get it right here. Within that 24-year period, a number of immigrants from the Caribbean came and settled here, and they mainly came and worked in the NHS and on land and transport, and other areas of industry which were being underemployed by the local community. And of course, these nurses came and they took a lot of vitriol. They took a lot of racism and they made a lot of sacrifices by leaving their families, Peter. You don't understand that. These were trained nurses, trained in the Caribbean, who, when they came over here, had to re-educate themselves. Their nursing qualifications were not recognized.
Right. That's very sad.
Very sad.
That was really the question, why they were invited. And I think that in multiple parts we we have that very well indeed. Just a quick question as well, obviously, about the statue. You said June was the initial date. It has now been postponed to October. We don't really know when the virus is going to end, though. It might take a little bit longer, right?
That's a good point. That's a great point. So October is the new proposed date.
Yeah.
And if the current easing continues incrementally as it is, then yes, we will do it in October. But clearly we don't know what the future holds and what social distancing is going to look like in October. So I guess it's a tentative alternative date. But I have to be honest, at the moment, we're very confident that October will be the day that we install this national statue, which will be of international interest as well.
Yeah, of course. And who will be there from the UK? Obviously, Whittington Hospital, NHS, yourself, anyone famous that you have invited? Or?
Oh, yes. Well, clearly there's been members of the royal family which have been invited. We haven't yet been able to confirm their attendance because, in truth, the date in October has not been pinned down. So we do have a week window that they are looking at. So once we confirm, then they'll let us know. But we do have people from the Royal College of Nurses, RSCN, and the Royal College of Midwives, and obviously senior people within the NHS. We also have some interest in nursing organisations, the Retired Caribbean Nursing Association, for instance, the Nigerian Nurses Association, etc. All the different Commonwealth groups of nurses will be represented in some way or the other, Peter.
Right. Now that's brilliant. Obviously, you mentioned that the RCN, that's the Royal College of Nurses, from what I understand. They actually mentioned very recently that the reality is that the health and care workers are at increased risk from the coronavirus, simply because they're doing their job. So I think this is a very good moment, really, to honor that. The Doctors Association actually mentioned that the healthcare workers are at considerable risk. particularly because they have a lack of protective
PPE,
PPE, personal protective equipment for those who don't know what that means. But basically what it means is that nurses are doing exceptional things, and I would say in exceptional times, and that goes a long way back. Antonia, what do you think about this? And we mentioned the numbers earlier from the BAMI communities. You work yourself in a center, COVID-19 center. Do you have a lack of equipment there, or is everything well organized for you?
We well covered with equipment, and indeed, I also have my own company called African Diaspora United. And I managed to source some protective head shields, and I'm willing to donate them to our BAME frontline workers. So this is another thing I'm prepared to do, because I think there is a lack of equipment. And one of my friends, she's a nurse, she told me that once she got to a sector to help, to work, and because she had the protective equipment, and there wasn't enough for everyone, they had to work on that day without protective equipment, because they said it wouldn't be fair for her to be the only one to use, which I think is quite appalling on NHS to put the frontline workers at that risk. So, because I know so many people in the community, I've been like resourcing materials. I also created a collection of African face masks, which are reversible and washable. And also the headbands to protect a little bit more, too much. And I'm willing to donate some for our brothers and sisters, really. I think Mr. Boris Johnson really is bringing lots of uncertainty to this, especially to our frontline workers, because he's not providing them not just with the protective equipment, with the PPE, which is the personal protection equipment, but he's also bringing them into confusion when he says he's going to provide these trackers, and we don't know the dates. We don't know when these trackers are going to be available, because I believe even working at the community center or working in any other company, it would be much better if we could have some of these trackers in the front door, so we can check the staff. If they healthy enough to go to work, you would actually prevent the reinfection or having another problem to do with COVID-19. Because really and truly, we don't just want to get rid of the COVID-19, but also to protect ourselves, because we don't know what's going to happen when the situation is really.
Actually, over the past 2 days, I read something that they had, was it yesterday, just a few new cases, and today also a few new cases, even though quite a few people dead again, over 200. So, but the whole thing seems to ease down a little bit, but that again, and the lockdown has eased as well. What do you think? Do you think it? Do you have any idea? Do you think it might go up again, or do you think it will stay the same and the situation will get better? What are your feelings?
To be honest with you, Boris Johnson is transmitting us different mixed information. Because 1 minute he wants to ease the school, he already gave us few dates. I think the last date I heard today on the news was the 1st of June. But at my little girl's school, it's going to be just for year 1 and year 6. The parents are terrified, because I came across to some of my neighbors, some of the mothers, and they're just terrified. They don't know what to do. So it's a big confusion there. And the fact that the news only talk about COVID-19 is like they forget that people die for different illnesses and diseases. And then there is the issue of mental health, which I'm also interested to work with, because after all of this, even right now, mental health and domestic violence is increased a lot.
That's quite worrying as well. Is that because people are more at home, and will that ease when the lockdown eases, or?
I think if the government can actually protect and give a long plan measurement to protect the front line, the BAME workers, if you can protect them, you'd be very, very good, because they're doing a great job, but they can't afford to risk their lives, and then knowing if something happened to them, their families will have no status. They will have to go back to their countries, and some of these countries, there is not even food to eat. So this is a constant worry they're living with.
It's quite worrying, and you're very rightly pointing that out. I must say. I think though that it's the right moment really to honor the nurses and the midwives. I believe you've done a previous project already, Jack. It was the memorial to the African and Caribbean service personnel. It was in Brixton. I've seen some photographs. I've seen some of the articles and some of the quotes as well. Not only from the mayor of London, but also of Her Majesty the Queen. Really,
we were fortunate. That Her Majesty the Queen publicly endorsed it, so that was really good. I also met Prince Charles and Camilla as a lead up to the memorial. So we had a lot of support from the establishment, as it were, and also the Home Office also made a generous donation. Well, a small donation, which turned out to be significant to install it. So this is now the women's turn, and like I said, it's also interesting that some of the women who were being affected, I'm talking about the women as in nurses who were affected by the Windrush scandal, have been asked to return back to the NHS. How wonderful and amazing is that? Isn't that amazing, Antonia?
And some of them was already retired,
Exactly. So they're in that target group of people who are vulnerable. And you know what, Peter? They still have gone back and helped. This is the remarkable nature, because when you are a nurse, you don't do it for money. You know what I mean? You don't do it for a living. You do it for a vocation as your duty. And that explains, Antonia, as we were saying, why people are dying, because they, especially the BME, those from the BME community, for whatever reason, whether they are put in the firing line more than others, whether others are taking time off, these people do it because they love nursing. They love helping people, Peter. So
because they are the part of the BIME, isn't it?
Yes, exactly.
And we know that they make up to 60% of the adults on social care and staff on the NHS, really.
Yes.
But funny enough, the patients are now very concerned because 20% of the deaths are people who caught COVID-19 in hospital. So, it's very confusing. People are very worried now. I came across many patients in my community because some of them don't speak the language and I have to do interpreting for them. And they tend to cancel their appointments. Even though they're very vulnerable patients, they are canceling their appointments. So this is not right.
The hospital.
The hospital appointments.
Of course. Yeah, it's understandable.
I read somewhere that people from ethnic minority backgrounds are overrepresented in overcrowded accommodation and households with multiple generations under one roof. Would that be one of the reasons as well why they're more vulnerable to a virus like this?
Can I answer that? Here's the thing I have. I'd like to make this contribution, Antonia. Here's the thing I have. So the doctors tend to be of a from a higher background in terms of they're not in overcrowded accommodation, for instance. You'd think that they have made enough of a living that they could have reasonable surroundings. But in this country, the first 16 of the 17 doctors that died in NHS were of colour. That's quite disturbing, especially when you compare the numbers, for instance, Antonia, to America. The first two doctors that died were European American.
So why is that? So that's not because they live in overcrowded households, then, is it?
Correct.
That must be a different reason for. Are they more on the forefront, these communities? Is that what it is? Or
that is what it is perhaps these doctors are being, as Antonia said, not given the right equipment to protect themselves, and they're being placed in vulnerable position. Some of these doctors are agency doctors, and they are given. COVID patients, for instance, where other nurses and doctors from other backgrounds may be given a less, threatening patient to deal with. I don't know. All of that will come out in the wash subsequently. But I'm just comparing the numbers, and the numbers suggest that something else is going on. It's not just to do with overcrowding. There's definitely a PPE equipment issue, and there's also the propensity that BME doctors may be given more, contaminated patients than somebody else. I don't know.
But I also believe the situation with hospital. I agree with what Jack said, but I also believe that the situation when it comes to why are these patients more more likely to die. From my point of view and my studies, is because, as you can see, men are more likely to die with COVID-19 than women for some strange reason.
Yes.
And then these particular doctors, maybe they've got underlying issues, but because it's an emergency situation, some of them are from Majesty, some of them are coming from the Windrush, and from other settings, they wasn't even at work any longer because maybe they're vulnerable, but they are still heroes of forgetting about their own health to go and help others.
This is the point.
It's like I've got vulnerable people at home, but it doesn't mean that I cannot do a little extra to help. Because if everybody thinks that way, things are going to work much better. Because together we do things better. But it's just. I think the government, especially the Home Office could actually help if they have an input when it comes to giving status to these families, to these heroes' families, because they're living in anxiety, knowing that if anything happened to their partners who's got status in a country, they will have to be deported. And most of them got a family they're supporting. Maybe the people at home are not working. So this is a big issue that needs to really be addressed in order to protect the people who are working with NHS and social services in the front line.
It's like the 50s all over again. It's like I said, it's cyclical. And then what will happen, there will be a calm, and then suddenly people have forgotten about these contributions. I hope that's not the case.
I'm sure they made some movies about it.
Well, this is why we come back to the statue.
There's few movies already. There's few movies already about COVID-19, but they came out a long time ago. The pandemic and all of those. I watched one of them and I was thinking, what a coincidence. Everything that's happening now.
Which movie did you watch, may I ask? Which one was it? Outbreak?
It's the Pandemic on Netflix.
On Netflix. Okay, that one. Okay, that's the series there. Indeed. All right. I think that everyone is very well aware why we should really honor nurses, and I think the project you're working on, Jack, is absolutely fantastic.
Lovely.
Is there anything that you would like to say to people that are listening to the podcast? Let's start with Antonia.
Okay, I'd love to leave a message that we're going through a very difficult time. It's like COVID-19 made us realize that it doesn't matter how much money you've got or how much knowledge you've got. We are all in the same position at this point. So what I was about to say is, even if you've got vulnerable people in your family, or even if you are scared or not sure, always be positive and think about what can you do to help that next person, because you don't really need to go into the community to help that person. All it takes is to pick up that phone and make a phone call to that lonely person, or maybe just say hello to your neighbor from your window. Little things that we could do to help each other, because it's just a difficult moment for all of us.
Yeah, that's fantastic.
It's a very difficult time. And also I'd like to say that, the Africa and the Diaspora United is willing to offer some facial shields to the NHS BMA frontline. So we just, we as a community can do this. People have to be positive and keep on doing what they're doing, because they are our heroes.
Yeah, absolutely. Jack?
I think the lockdown has been a great time for us to reevaluate, reconfigure, reanalyze our priorities and see where we are or were going. I think in the UK particularly, we were just coming out of a session of Brexit where xenophobia was perhaps entering part of the political discourse. And I hope that this unfortunate lockdown has made us reevaluate and realize that we all need each other. We're all independent on each other. And if people do forget, there will be a 7 foot high, 7 foot wide, 16-piece statue to remind them.
Which has been designed already, huh?
Which has already been designed already and is in manufacturing, and is, as we've already said, hopefully will be installed before the eyes of the world in October. So watch this space. Yeah.
Brilliant. Thank you very much, both of you. That was absolutely fantastic and very good to have your input. Thank you.
Okay, thank you very much. Thank you, Jack. Thank you, Peter.
Thank you.
So that was the podcast. I'm very happy that I had all three of them, Michelle, Antonia and Jack, on the podcast in the show. I'll put the links in the show notes, and you can find more information as well on our website. That is podcast.earth. Thank you for listening. Please don't forget to tune in next time.